What's going on, world? Welcome. Hey, happy motherfucking Monday. Wait, can I not say that? I don't think I'm not supposed to say that. But anyways, what's up, everybody? How y'all doing? Oh my God, that is bright. Go ahead and tone that down just a smidge. All right. What's up, y'all? How y'all doing? Welcome. You guys already know we're about to do some NCLEX questions. We are going to be doing NCLEX questions today. First of all, hopefully everybody had a really good and safe weekend. That's number one. Number two, shout out to everybody that's graduated. Number three, if you got that NCLEX, if you passed your NCLEX, let us know down in the chat. All right. Hey, I need 1,000 likes and I need 100 people up in here. If I don't get 1,000 likes or 100 people in here, I need both. If I don't got them, I guess y'all don't get no questions. You know what I'm saying? It says, yeah, I'm hyped summer before my last year. Hey, that's what I'm talking about. Katie graduated. Shout out to you, Katie. Shout out to you for graduating. I know we were talking back and forth about that. So, but what's up, everybody? Hey, I want to know who you are, where you're from, where you're at in your nursing journey. Like I said, I need 100 folks up in here and I need 1,000 likes. Hey, so every 10 questions, every 10 questions, 10,000. Every 10 question, 10,000. I'm saying I had 30 questions on Friday, but I only got to 20,000. I think I only got to 15,000. So y'all only got 20 questions. So, I mean, hey, so that's all y'all got. So, hey, the more that y'all participate and the more that you guys smash that like button, whatever, hey, the more that you guys get. You know what I'm saying? But hey, if you guys are just now joining, my name is Kevin. I'm a registered nurse. I have been a registered nurse for almost 4 years. I've worked ICU, OR, and PACU. I also was in the Navy for 16 and a half years. And yeah, bringing the talents over here to good old TikTok. So, like I said, I got 126 people up in here. Hey, and also I need 100 likes. All y'all are graduating and everyone can benefit from this. All right. Even if you're in nursing school, you can benefit from this because when do you start preparing for NCLEX? In nursing school. I didn't say you have to prepare heavy, but just make yourself familiar. Understand what the questions look like. All right. Understand what the format looks like and then understand what they are asking you. That's the big thing. All right. That's the big thing. So like I said, hey, who are you? Where are you from? Where are you at in your nursing journey? Are you not a nurse? Have you been a nurse for a while? Are you in nursing school? Are you doing your prereqs? Are you a brand new nurse that's has imposter syndrome really bad like everybody else? Let me know. Let me know what's up. I gotta start putting on music. I gotta start putting on some music. Currently waiting my ATT. Shout out to Kiki. All right, hey, I'm almost to 1,000 likes. Hey, y'all are killing it. There we go. Hey, there it is, y'all. There it is. Hey, look at that melanated guy right there. You know what I'm saying? I got y'all. And a student nurse in Texas. Hey, shout out to all my folks from Texas. I live in Texas, so shout out to everybody out there. Nurse from Ghana, love it. Here we go. Question number one. The nurse is aware that the following terms used to describe reduced cardiac output and perfusion impairment due to ineffective pumping of the heart is what? Is it anaphylactic shock, cardiogenic shock, distributed shock, or a myocardial infarction? I graduated a week ago and studying for the test. Love it. Hey, love it. Hey, if you're in nursing school, if you just graduated, keep studying. Hey, don't stop. Don't stop studying. All right. You have to keep pushing through. You have to keep pushing through, all right? Push through the finish line. Don't stop before the finish line, all right? I'm in nursing school. Shout out to y'all. Hey, if you guys are just now joining, by the way, I got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there. You guys can check those out for yourself. Brighten that up a little bit. All right, there we go. LB, Long Branch. I don't know what that means. I take my NCLEX on Friday. Shout out to you. Is it a Princess? Hey, you got it. You've been preparing for it. All right. Hey, remember, a lot of people are very nervous about preparing or about taking the NCLEX. Hey, if you prepare for the exam, how the exam is actually laid out, hey, you won't have that big of a problem. All right. But here we go. The answer is B. It's cardiogenic shock because it indeed is related to the ineffective pumping of the heart. Cardiac, cardiogenic shock, right? Part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Brittany says tomorrow what? You take your NCLEX tomorrow. Hey, usually I tell people not to be here, right? You don't need to be here. I consider this cramming. All right. But hey, if you want to be here and you want to continue to do that to yourself, then do that. But I recommend going away, relaxing as much as you possibly can. Preparing for that exam tomorrow, going to bed early enough, and then going and do your thing. Make sure you guys smash that like button. Hey, I need a bunch of shares, and I need you guys to follow. All right, because I do these Monday, Wednesday, Friday at 5:30. All right, here we go. Question number two: a client with hypertension asked the nurse which factors can cause blood pressure to drop to normal levels. All right, is it kidney excretion of sodium only? kidney retention of sodium and water, kidneys excretion of sodium and water, or kidney retention of sodium and excretion of water. What are we thinking? Hey, if you guys are just now joining, we're on the road to 10,000 likes. We're on the road to 10,000 likes. All right. If I don't have 10,000 likes by the time I get to question 10, I guess y'all are only getting 10 questions today here on this Monday. All right. Hey, make sure you guys share it with Becky with the good hair. You know what I'm saying? Or Susie with the good shoes. I don't know what y'all. I don't know what the kids say nowadays. But make sure you guys follow. You guys share it. All right. And also, like I said, I want to know who you are, where you're from, and where you're at in your nursing journey. Got a bunch of people saying C. Girl, get on with it. You telling me to get on with it? Oh, Jalen, you must be new here. You must be new here. We don't do it on your time. We do it on mine. I take my NCLEX on the 29th. Shout out to you. I take my NCLEX in 10 days and I need this review. Okay, if you need this review, don't tell me to get on with it. Just chill and relax and understand what's happening right now. All right, here we go. All right, here we go. Here's our answer in 3, 2, and the answer is C. It is kidneys excretion of sodium and water. The kidneys respond to rise and blood pressure by excreting sodium and excess water. This response ultimately affects systolic blood pressure by regulating blood volume. Also part of physiological adaptation, which is 11 to 17% on the NCLEX. It is the third largest section on the NCLEX exam. It says you got a lot of nerve, lady. Hey, come on now. We all good. Hey, it says took mine today. You took what today? Is it Keontae? Keontae, you took what today and passed? I need for you to specifically tell me what you took today and what you passed. That's what I want to see. All right. That's what I want to see. Shout out to all 128 of y'all. We're doing NCLEX questions. I got them off nurseslabs.com. Hey, if you got an exam in 10 days, you surely can go to nurseslabs.com and review these on your own. All right. I'm just saying, Kevin is sassy today. Ma'am, I don't know if you're new here because it's my first time seeing your name pop up here, but I'm like this all the time. Don't play with me. All right. Here we go. Just started my summer semester. 3 more to go. I love to see it. Jalen, you should be studying on your own. Hey, look, you already let her know. Hey, they don't play about me, Jalen. They don't play about me. All right, here we go. Hold on. September Stone, what we got? Tell me. Talk to me. All right, Nurse Rose is aware that the statement that best explains why furosemide or Lasix is administered to treat hypertension is what? It dilates peripheral blood vessels. It decreases sympathetic cardioacceleration. It inhibits the angiotensin converting enzymes, or it inhibits the reabsorption of sodium and water in the loop of Henle. What are we thinking? Loop of Henle. What's up, Bria? How are you? Hey, if you guys are just now joining. Okay, Jalen, you Gucci out here. All right, you Gucci. It's hard to interpret what somebody is saying, through a message. All right. You took your NCLEX today and you passed. Oh, snap. Hold on. I got it. Keontae, hold on. Hey, y'all see Keontae right there? I need for y'all to show Keontae love right now. All right. I need for y'all to smash that like button and tell Keontae that she is awesome. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody out here, man, what would it be? And once again, congratulations to you. September Stone, you passed what? What'd you pass? I need for you to tell me. All right, let's see what our answer is. And the answer is D. It inhibits the reabsorption of sodium and water in the loop of Henle. Furosemide is a loop diuretic, all right, that inhibits sodium and water excretion in the loop of Henle, thereby causing a decrease in blood pressure. That is part of pharmacological and parenteral therapies, all right? Pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. But hey, September Stone, shout out to you, Miss Ma'am. You already know the deal. Super proud of you. We've been going back and forth talking about that. So welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody out here, ma'am, what would it be? And once again, congratulations to you as well. That's 2. Hey, if you pass NCLEX, hey, come over here. That way we can celebrate you together. All right. Because that's what we do. We celebrate one another. All right. No more of this tearing down stuff, y'all. There's no more of that. We got to stop that. Here we go. Question number 4. Nurse Nikki knows the laboratory results support the diagnosis of lupus is what? Is it elevated serum complement levels? Is it thrombocytosis, elevated, the sedimentation rate? Is it pancytopenia? which with our elevated ANA titer, or leukocytosis with an elevated BUN and creatinine level? What are we thinking? Shout out to all 109 of y'all. We are doing NCLEX questions. Hey, we got these questions off of nurseslabs.com. Nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. All right. Hey, a little bit about me if you're just now joining. Been a nurse for almost 4 years, worked ICU, OR, PACU. I did 16 years in the Navy. Yeah, I did 16 years in the Navy, y'all. So shout out to y'all. Hey, anybody if you ever want to go nursing in the military, it's a good spot to go. Good spot to go for you. All right, but the answer is C. It's pancytopenia with elevated ANA titer. All right, laboratory findings with client with SLE usually show pancytopenia with an elevated ANA titer and decreased serum complement levels. That's reduction of risk potential, which is the fourth largest section on the NCLEX at 9 to 15%. 9 to 15%. All right, so management of care, farm, physiological adaptation, and reduction of risk potential make up more than 50% of the whole exam. All right. Remember, there's 8 sections, and those 4 alone make up more than half, almost 60% actually. So just letting y'all know, LPNs, that you guys learn the same content that registered nurses learn. All right. You guys learn the same content that registered nurses learn. You need to know what you can and cannot do and what you can and cannot accept. All right. Doesn't matter what your state says. It's not a state thing. It's a national exam. Okay. Here we go. Question number 5. Arnold, who is 19 years old with a mild concussion, is discharged from the emergency department. After discharge, he complains of a headache. When offered acetaminophen, his mother tells the nurse the headache is severe and she would like her son to have something stronger. Which of the following responses by the nurse is appropriate? Now we're talking about somebody who has a concussion, so a head injury of some sort. What do we want? How is the best way for us to respond to this patient or to the mom? All right. Your son has a mild concussion. Acetaminophen is strong enough. Aspirin is avoided because of the danger of Reye syndrome in children or young adults. Narcotics are avoided after a severe head or after a head injury because they may hide a worsening condition, or stronger medications may lead to vomiting, which increases ICP. What do we think? Everybody screaming C at me. Everybody screaming C. What's up? What's up? Hopefully I didn't miss anybody. Everybody screaming C. Thanks, everyone, and congrats to all of us that's passed. Love it, love it, love it, love it, love it. Hey, shout out to all 88 of y'all. We're doing NCLEX questions. Like, I want to know who you are, where you're from, where you guys are at in your nursing journey. Where are you guys at in your nursing journey? All right, what are we thinking? All right, y'all, here we go. Here we go. Just graduated. Shout out to you, Alexis. All right, here we go. Here's our answer in 3, 2. All right, and the answer is C. Narcotics are avoided after a head injury because they may hide a worsening condition. Narcotics may mask changes in level of consciousness and indicate increased intracranial pressure. That's health promotions and maintenance. Is it Lynn's? You take your NCLEX on the 29th. Shout out to you. Keep pushing forward. All right. Y'all are smart. Y'all are smart people. All right. Don't let this test that has no emotional ties to you whatsoever, take what you've worked so hard to get through. The hardest thing about nursing is getting through nursing school. All right. The NCLEX, if you prepare correctly for it, you're gonna do just fine. So shout out to everybody. Going into my junior year, okay, starting my nursing journey in the fall. Shout out to you, Reese. All right, here we go. Hey, ladies and gentlemen, real quick. Hey, I got some test taking tips. If you're a frequent flyer, you obviously already have this. But if you're new here, go over there and get you some test taking tips to help you conquer the NCLEX. Is it free? Yes. You surely can get it for free. It is 42 pages of awesomeness that's in there. All right. 42 pages. You can find it. It's in my link tree in my bio, or you can go to that website right there and it'll take you directly to it. All you got to do, put in your name and your email, and it's going to get sent to you directly. All right. Directly from me. So make sure you guys go over there and check that out if that's something that you need. We're at the height of NCLEX season. So go over there and get you that thing. All right. Just graduated. Is it Shania? Shout out to you, Shania. Question number 6, when evaluating an arterial blood gas from a male client with a subdural hematoma, the nurse notes that the PaCO2 is 30 millimeters of mercury. Which of the following responses best describes the result? It's appropriate. Lowering CO2 reduces intracranial pressure. It's emergent. The client is poorly oxygenated. It's normal, or it's significant. The client has alveolar hypoventilation. What are we thinking? What are we thinking? All right, we got A's, we got B's. We ain't got no D's. No D. Oh, there goes one. Dungeon Dragon with the D. Ali is telling me A. Okay. All right. Kiki's telling me A. Right when I said there's no D's, Dungeon drops one. So that's funny. All right. Maritza is telling me B. Okay. Let's think about that. So think about our disease process. All right. Think about this. My patient has a subdural hematoma, right? And they have a PaO2 or PaCO2, right? So when we're talking about anything that has to do with the head, we're talking about how can we increase or decrease intracranial pressure, right? So the correct answer is A. It is appropriate. Lowering the CO2 reduces intracranial pressure. It is normal for somebody who has a subdural hematoma, right? Because we want to decrease the intracranial pressure, right? That's what we want to do. All right, so the normal PaCO2 is 35 to 45. Mylanta, not the DJ Tanner. Then it's for 35 to 45, right? Has vasodilating properties. Therefore, lowering the PaCO2 through hyperventilation will lower ICP caused by dilated cerebral vessels, right? That's reduction of risk potential. Reduction of risk potential, 9 to 15% on the NCLEX, making it the fourth largest section on the NCLEX exam. That's okay, though. I'd rather, if you don't understand it, listen to me. If you don't understand it, all right, if you don't understand it, make sure you go back, you read your rationales. All right, when you read your rationales, they tell you why you got it right or why you got it wrong. And then you circle back and you get that content for yourself. All right, here we go. Question number 7. When prioritizing care, which of the following clients should the nurse Oliver assess first? Right off rip, I already know this is a management of care question, right? Just because of how the question is set up. Right? It's telling me I need to prioritize. Okay. And then it's telling me, who do I see first? So who's going to die if I don't see them first? Is it a 17-year-old, 24 hours post appendectomy? And I'm going to mess this up. A 33-year-old client with a recent diagnosis of Guillain-Barré syndrome, a 50-year-old client 3 days post myocardial infarction, or a client with diverticulitis. Which one? I'm waiting for somebody to correct me in the chat because I'd be saying is it Guillain-Barré, Guillain-Barré? Y'all know what I'm talking about. B, keyword is recent. Noemi. Okay, girl. Keyword is recent, right? That's a big keyword, right? But then we also have to understand what is Guillain-Barré syndrome. If you don't understand these disease processes, you want to be able to understand it. It says, child, I say it the same way. Listen, okay? I think I said it right. Listen, I said Guillain-Barré or Guillain-Barré. Nobody was answering me. They were just correcting me in the chat. I'm like, damn, answer the question. Like, my God. Ascending paralysis. Okay. Katie's smart over here, y'all. Katie's smart. All right. So we have ascending paralysis. So what issue what could become paralyzed that is a really big issue for us. 24 hours post isn't necessarily priority unless as a new onset. Shout out to you. Airway priority. Look at y'all. Y'all so smart. All right, so it is B, a 33-year-old client with a recent diagnosis of Guillain-Barré syndrome. All right, it's characterized by ascending paralysis and potential respiratory failure. The order of client assessment should follow the client's priority with disorder of airway, breathing, and circulation, but also look at the level of consciousness. All right, the diaphragm. There you go. Keyword is recent. Yes, these are the test-taking strategies, y'all. These are the test-taking strategies that you have to look out for. This is part of management of care, which is the largest section on the NCLEX at 15 to 21%. LPNs on the NCLEX PN, it is 18 to 23%. Regardless, it is still the largest section on both exams. All right, it's still the largest on both exams. All right. Here we go. Question number 8. JP, whoever that may be, has been diagnosed with gout and wants to know why colchicine is used in the treatment of gout. Which of the following actions of colchicine explains why it's effective for gout? All right, it replaces estrogen, decreases infection, decreases inflammation, or decreases bone demineralization. What do we think it is? Everybody screaming C at me. Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off of nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. All right. If you're new here, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? Colchicine decreases inflammation and gout. Okay, Laura. Don't hurt him now. Don't hurt him now, Laura. Don't hurt him now. All right, what are we thinking, y'all? Got a bunch of people screaming C at me. Cool. All right. Long Beach in California. Okay, shout out to California. All right, y'all, here we go. Hey, I live in Texas. I got any other Texans out here? You know what I'm saying? I live in San Antonio. How we doing? You know what I'm saying? That's why I want to get a feel for the room. All right. But the answer indeed is C. It is decreased inflammation. The action of colchicine is to decrease inflammation by reducing the migration of leukocytes to synovial fluid. Shout out to you, Laura. San Antonio. Physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Shout out to the Philippines. So my best friend lives in San Antonio. Love to go visit her. Love the area. It's a nice area. Depends on where you go. Hey, fam, what's the deal? Hey, so remember, a physiological adaptation, it consists of acute issues, trauma, right? Those are the things that we're looking for. The disease processes and how they affect the body, all right? The disease processes and how they affect the body. Shout out to Puerto Rico. Okay, here we go. Question number 9. Norma asked for information about osteoarthritis. Which of the following statements about osteoarthritis is correct? It's rarely debilitating. It's a rare form of arthritis. It's a common form of arthritis, or it affects people over the age of 60. All right. Shout out to the ATL. I've never been there. No, I take that back. I've been to the airport. That's as far as Atlanta that I've ever been to. So Hannah's in the building, y'all. Hannah's telling me D. Allie's telling me D. All right. Shout out to y'all. Shout out to y'all. You got to come. Listen. Keith Lee told me not to go, so I'm not going. Oh, I'm sorry. My bad. I'm sorry. What do we think it is, y'all? What do we think it is? It's most definitely D, or most definitely C. I'm sorry. My bad, Shelby. I misspoke. Too soon? No, it's never too soon. Keith Lee exposed the city. Now, I got a buddy that lives in Decatur. I thought about going to go visit him, so we'll see. But here we go. The answer indeed is C. Osteoarthritis is the most common form of arthritis, all right? It can be extremely debilitating. It can affect people of any age, although most are elderly, all right? Physiological adaptation, which is 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. So shout out to everybody that got it right. If you get it wrong, circle back, read your rationales, understand why you got it wrong, and understand why the answer is correct, and then circle back and look at the content for yourself. That's how you're able to retain. Everything goes full circle, all right? Everything goes full circle. My man, what's the deal? I see you, bro. Anime dude in the building. Hey, I saw that you got into that school, man. Congratulations to you. All right. Here we go. Question number 10. Ruby is receiving thyroid replacement therapy, develops the flu, and forgets to take her thyroid replacement medicine. Okay. The nurse understands that skipping this medication will put the client at risk for developing which of the following life-threatening complications? Is it ex-ophthalmos, thyroid storm, myxedema coma, or tibial myxedema? Myxedema. It's professional, Brody. I'm in the my man. That's what I'm talking about. Congrats, bro. Congrats to you, man. We got some B's. We got some C's. All right. We got B's and we got C's. Now, if I'm taking thyroid replacement therapy, that means what? I haven't learned this yet, but going to go with it. Okay, go with B. Cool. Thyroid replacement therapy. Hypo. Okay. Thinking about hypo. It says my gut is telling me B. Go with your gut then. Go with your gut. All right. So now, if we're understanding that it's hypo, which of the following conditions coincides with hypo? Coma, low and slow. All right. I'll give y'all 10 more seconds. Y'all, I think y'all are picking it up, though. Y'all are picking up what I'm putting down. All right, let's see. Let us see what the answer is. And I lied. Here we go. And the answer is C. It's myxedema coma, or severe hypothyroidism, because it is a life-threatening condition that may develop. And if thyroid replacement medication isn't taken, that's actually part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 13 to 19%. That's how you, Laura, you're welcome. This is how you have to break it down. And if you did not pick that, understand which ones are coincide with the other. All right. Thyroid storm is life threatening, right? But it has to do with hyperthyroidism. All right. Hyperthyroidism due to the excessive release of thyroid hormones, right? That's why. This is why it's important that we read our rationale. So I don't care where you get your questions from. I don't care if you get them right. And I really do care if you get them wrong. However, if you get them right or wrong, you need to be reading every rationale, every single one, even if you got the question correct. All right. So make sure you guys are doing that. Shelby, no need for the face plant. This is how we do it. This is how we do it. All right. Anyways, test taking tips. Go. Hey, I've been beating the dead horse. You already know what the deal is. Hey, 42 pages. 42 pages. It used to be one of my ebooks, y'all. If you're new here and if you don't have that, go get that because that is going to be gone at some point. All right. Free download, thebootnurse.com/test, or you can check it out. The link is in my bio. You see what I'm saying? You get everything but the kitchen sink and my fanny pack. If you don't got a fanny pack, go to Walmart and get one for $6. Stop being that way. All right. Unless you want to drop all your stuff on the floor. It's bad. We don't want you to do that. All right. Here we go. Nurse Sugar, who probably... Never mind. Nurse Sugar is assessing a client with Cushing's syndrome. Which observation should the nurse report to the physician immediately? All right, immediately. So what is not good that requires the doctor's attention right here and right now? Pitting edema of the legs and irregular apical pulse, dry mucous membranes, or frequent urination. What do we think it is? What do we think it is? Now, think about Cushing's syndrome. Think about what is expected versus not expected with Cushing's syndrome, okay? B is serious. It might be. It might be. What is unexpected? No, first answer this question. If we know about Cushing's syndrome, let's apply what we know versus trying to apply what we don't know. So what is expected to see with somebody with Cushing's syndrome? That's what you have to ask yourself. And then you do your process of elimination. Do I expect pitting edema in the legs? Do I expect an irregular heart rate? Do I expect dry mucous membranes? And do I expect a frequent urination with somebody with Cushing's syndrome? All right. So the one that is not expected based off of you categorizing them, that would be your correct answer. All right. Now let's see. Let us see what the answer is. Let us see. Here we go. And the answer is B. It's an irregular apical pulse. All right. Now, a lot of y'all are just like, oh my God, Kevin, why? Listen, I'm about to tell you why. I'm about to tell you. All right. So because Cushing's syndrome causes aldosterone overproduction, which increases urinary potassium loss, the disorder may lead to hypokalemia. Yeah. Hypokalemia, meaning we have a low potassium. Therefore, the nurse should immediately report any signs and symptoms of hypokalemia, such as an irregular apical pulse, to the physician. All right. How we doing? We good, man. How we doing? How are you doing? Dr. Sir Johnston Williams III. All right. Physiological adaptation, third largest section on the NCLEX exam at 11 to 17%. All right. The biggest thing is that we're looking at, that's a circulation issue. And we're going to start with, yes, Ali said cardiac dysrhythmias, 100%. That's what we're going to be looking out for. All right. So that's a good question. All right. Those are the things that you got to be looking out for, is because I tell you about Cushing's syndrome. All right. But even if you don't know, let's look at our answer choices so we can kind of figure that out. All right. Here we go. Question number 12. Cyril, whoever that is, with severe head trauma sustained in a car accident, is admitted to the intensive care unit. 36 hours later, the client's urine output suddenly rises above 200 mLs an hour, leading the nurse to suspect diabetes insipidus. All right. Which laboratory findings support the nurse's suspicion of diabetes insipidus? Is it above normal urine and serum osmolality levels? Below normal urine and serum osmolality levels? Above normal urine osmolality level? Below normal serum osmolality levels? Man, those are some crazy words. Below normal urine osmolality levels or above normal serum osmolality level? What do we think? What are we thinking? We got some B's. Oh, no, we don't. We got a D's and some C's. Kiki is telling me D. So is Bria. Mahar is telling me C. Is it Solania? That's a nice name, Solania. D's, there it is. All right, y'all. What are we thinking? Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. These are both for RNs and LPNs. You guys can go over there to that website and check them out for yourself. They're free. So go over there and get them. All right, go over there and get them. Let's see what the answer is, y'all. Let us see what the answer is in 3, 2. And the answer is B. It is below normal urine osmolality levels, above normal serum osmolality levels. And diabetes insipidus, excessive polyuria, right, causes dilute urine, resulting in below normal urine osmolality levels. At the same time, polyuria depletes the body of water, causing dehydration. That leads to an above normal serum osmolality level. That is physiological adaptation. This is understanding the disease process and how it affects the body. That is what physiological adaptation is about. All right. Remember, it's 11 to 17% on the NCLEX, making it the third largest section. LPNs, you have to know the same content. As RNs do. All right. So don't forget that. Shout out to everybody that got that right. If you got it wrong, circle back, get the content. All right. Here we go. Question number 13. Shoot the hole, Jamari. I'm sorry. Jamari is diagnosed with HHNS and is stabilized and prepared for discharge. All right. When preparing the client for discharge and home management, which of the following statements indicates that the client understands her condition and how to control it. All right. Now think about it. Who can tell me down in the chat what this what is this disease process? What does it have to do? Like, what is it a part of? All right. I can avoid getting sick by not becoming dehydrated and by paying attention to my need for urinate drinks, and eating more than usual, greater than 600. All right. If I experience trembling, weakness, and a headache, I should drink a glass of soda that contains sugar. Diabetes. All right. Which one? Which type of diabetes? All right. I will have to monitor my blood sugar level closely and notify the physician if it is constantly elevated. All right. If I begin to feel especially hungry and thirsty, I'll eat a snack high in carbohydrates. All right. What do we think it is? Shout out to all 79 of y'all out here rocking. We're doing NCLEX questions. Even if you didn't understand what hyperosmolar hyperglycemic non-ketotic syndrome, all right, even if you didn't know what that was, your answers can tell you because it's talking about blood sugar. All right. We're talking about something in endocrinology. So we're talking about diabetes. All right. Talking about type 2 diabetes. All right. So let's think about this. Like, what is something that we want to make sure? What is the teaching? All right. The teaching that we are giving to the client, to the patient, right? That's something that they understand, that they said that was the correct answer. DKA has ketones and no ketones. Okay. All right, let's see what the answer is, y'all. Let's see what it is. And the answer is A. I can avoid getting sick by not becoming dehydrated and by paying attention to my need to urinate, drink, or eat more than usual. All right, that is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. All right, inadequate fluid intake during hyperglycemic episodes often lead to HHNS. By recognizing the signs of hyperglycemia, such as polyuria, polydipsia, polyphagia, and increasing fluid intake, the client may prevent HHNS. Right. So when it comes to DKA as well as HHNS or HHNK, whichever one you want to call it, the biggest thing that we want to do to maintain is we want to maintain the fluid intake. All right. I'm telling you right now, they will ask you on NCLEX, what is the first thing that you do for a DKA patient? And it is fluid resuscitation. We need fluids. Then you get the regular insulin in there, right, to push the potassium out of the blood into the cells. Right. That's what we want to do. Okay, so you have to understand how these disease processes work. All right, you have to understand how they work. All right, here we go. Question number 14. All right, question number 14. A 66-year-old client has been complaining of sleeping more, increased urination, anorexia, weakness, irritability, depression, and bone pain that interferes with her going outside. Grandma got some stuff going on, right? Based on these assessment findings, the nurse would suspect which of the following disorders. Is it diabetes mellitus, diabetes insipidus, hypoparathyroidism, or hyperparathyroidism? All right. Who can take a guess on what category that this question falls under? Who can take a guess? Everybody's telling me C. Okay. Brown sugar's telling me D. Okay. Who can take a guess on what category that this question falls under? Yari's telling me D. Mon's telling me C. Reese, D. Okay. Princess is also telling me D. Okay. Hypo, less calcium, physiological adaptation, right? Because what did I say? I said physiological adaptation has to do with acute issues, chronic issues, disease processes, and how they affect the body, right? We have a disease process that's in our answer choice, and it's telling us how it is affecting the body, right? Now let's see what the answer is. The answer is D. It is hyperparathyroidism, right? It is the most common in older ladies, and is characterized by bone pain and weakness from excess parathyroid hormone, right? Clients also exhibit calcauria causing polyuria. My goodness. All right. Physiological adaptation. All right. Physiological adaptation. All right. Physiological adaptation, which is the third largest section on the NCLEX exam. Third largest section on the NCLEX exam at 11 to 17%. All right. 11 to 17%. Hey, we're on the road to 20,000 likes, y'all. We're on the road to 20,000 likes. Here we go. Question number 15. Nurse Lords is teaching a client recovering from Addisonian crisis about the need to take fludrocortisone acetate and hydrocortisone at home. Which statement by the client indicates an understanding of the instruction? So what did the client state that was correct? All right. What did the client say that was correct? I'll take my hydrocortisone in the late afternoon before dinner. I'll take all of my hydrocortisone in the morning after I wake up. I'll take 2/3 of the dose when I wake up and 1/3 in the late afternoon. And I'll take the entire dose at bedtime. What are we thinking? I'm just learning this in LPN class. Well, look at that. You already got the cheat code. Me. No, but shout out to you. Everybody is in a different stage in their learning process. Noemi's telling me B. Are you sure? Noemi? Are you sure? Can you articulate to me? All right. Everybody's telling me B. Okay. Like, are you sure about that? All right, y'all. Shelby's telling me B. Quant's telling me B. Shout out to all 81 of y'all out here rocking. Hey, ladies and gentlemen, I just want to let y'all know that I've been a nurse for almost 4 years. I work ICU, OR, PACU. I was in the Navy for 16 years, y'all, and I failed my NCLEX 3 times. For all y'all that are new here, I failed my NCLEX 3 times. And let me tell you something right now. It's okay. It's okay. From somebody who was unsuccessful at that exam, it is okay. It is okay. But you know what else is okay? This answer. It is C. I'll take 2/3 of the dose when I wake up and 1/3 in the afternoon. Hydrocortisone is a glucocorticoid. All right. Should be administered according to the schedule that closely reflects the body's own secretion of this hormone. Therefore, 2/3 of the dose of hydrocortisone should be taken in the morning and 1/3 in the afternoon. This dosage schedule reduces adverse effects. All right. Health promotions and maintenance, which is 6 to 12% on the NCLEX. A smaller section, but all the sections are still very much important. Hey, get out of your own way, y'all. Get out of your own way. You are the reason. If you are unsuccessful at that exam in any shape, form, or fashion, you are the reason. All right. You can blame your instructors, which they don't care about you. You can blame your schools, who also don't care about you. You are your own worst enemy when it comes to this exam or anything. All right. So my question to you is, what you gonna do about it? Bria, you've been here long enough to know that I say the same thing all the time. I tell you all the time, get out of your own way. But I'm telling you right now, it is your fault. It is your fault on the way that it is. Ladies and gentlemen, I got some test taking tips. If you haven't picked them up, go pick them up. All right. 42 pages. 42 pages. Used to be an ebook of mine. All right. 42 pages, tips to conquer the NCLEX, free download. You get everything but the kitchen sink and that fanny pack. All right. bootnurse.com/test, or you can check the link in my bio. So, Bria, since this was the second time you were told that today, well, what are your thoughts? Tell me what your thoughts are. All right. Well, question 16, which of the following laboratory results would suggest to the nurse, Lynn, that a client has a corticotropin secreting pituitary angioma? All right. I'm getting out of my own way. I know that's right. All right, here we go. Is it high corticotropin and low cortisol levels? Low corticotropin or high cortisol levels? High corticotropin and high cortisol levels? Or low corticotropin and low cortisol levels? What do we think it is? What do we think it is? What do we think it is? Justin's telling me B. Kiki's telling me A. Hey, if you guys are just now joining, the live, we are doing NCLEX questions. Hopefully everybody had a really good Monday. It says, geez, I don't even know what that is. That's okay. Because I'm telling you right now, you're gonna come to questions on NCLEX, and they're gonna be hard. Like, it's gonna be stuff that you don't remember, or it's gonna be stuff that you've never seen before. I'm telling you, when you get to a point on NCLEX and they start giving you really hard questions, think to yourself, okay, it's hard. They're giving me hard questions for a reason. 9 times out of 10, I'm doing pretty well. All right, 9 times out of 10, I'm doing pretty well. All right, is it Caroslime? Caroslime is C. I don't know. I'm thinking it's A or C. Give me your best guess, Katie. Give me your best guess. Make a decision and run with it, because it doesn't matter what your decision is. It's either going to be right or it's going to be wrong. All right, C. Let's see what the answer is. And the answer indeed is C. Look at that. Look at that, y'all. Look at that. Saying A or C, but I'm going to guess A. Okay, look, there you go. The answer indeed is C. All right, the corticotropin secreting pituitary tumor can cause high corticotropin and high cortisol levels. All right, that's a reduction of risk potential, which is 9 to 15% on the NCLEX exam. On the NCLEX exam, 9 to 15%, making it the 4th largest section. Okay, how the heck? Listen, see, sometimes you just got to trust your gut. As a matter of fact, just always trust your gut. All right, because 9 times out of 10, your first answer is the correct answer. See, y'all, hey, listen. I want every single person in here to pass that exam on the first time. All right, I said that's my goal. That's my want. That's my desire. All right. Hey, but I can't believe in you more than you believe in you. You know what I'm saying? I'm not the one taking the exam. All right. So you got to believe it. You got to believe it. All right. Here we go. Question 17. A male client is scheduled for a transfenodal hypophysectomy to remove a pituitary tumor. All right. Preoperatively. I'm going to say it again, like my Dr. Umar. Preoperatively, the nurse should assess for potential complications for which of the following? Is it testing for ketones in the urine, testing urine-specific gravity, checking temperature every 4 hours, or performing capillary glucose test every 4 hours? Now, let's think about this. All right, everybody's telling me B. Oh, one person's telling me C. Okay. All right, Nadine. All right. Now let's think about this. We're going to remove what? We're going to remove what? All right. Remember, everything in the body is connected. So it's like, what exactly are we going to be looking out for, right? Remember, I have to make sure that my patient, because remember, this patient is going to have a surgery. They are going to have a surgery, right? And I need to know what is going to happen to them, because what's going to happen when they go to surgery? A lot of things start to drop, especially when they start getting anesthesia, right? Now I'm going to be having a procedure where I'm going to be removing something, a tumor in the pituitary gland. Okay, right? So let's see. Let us see what the answer is. And the correct answer is D. The correct answer is D, all right? I want to perform capillary glucose testing every 4 hours. All right. The nurse should perform the capillary glucose testing every 4 hours because excess cortisol may cause insulin resistance. I was going to say D, but you didn't. But you didn't say D. That was going to be your second choice. That's okay. That's all right. All right. Because it can cause insulin resistance, placing the client at risk for hyperglycemia. Reduction of risk potential. 9 to 15% on the NCLEX exam. Fourth largest section. All right. The fourth largest section. All right. Even if you pick A, just because there's ketones doesn't mean that the ketones in the urine doesn't mean that they're in ketosis. All right. So think about that. All right. This is why your pathophysiology is so important. My God was empty. Yup. All right, here we go. Question number 18. Capillary glucose monitoring is being performed every 4 hours for a client diagnosed with diabetic ketoacidosis. Insulin is administered using a scale of regular insulin according to the glucose results, all right, or a sliding scale, right? At 2 p.m., the client has a capillary blood glucose of 250, right, for which he receives 8 units of regular insulin, all right? The nurse should expect the doses to what? So if it's given at 2 o'clock and it's regular insulin, so what is the on peak? Oh my God, what is the onset, the peak, and the duration of regular insulin? That's how you have to think about it, because it tells us right there that this patient is getting regular insulin. The question or the answers are telling us about onset and peak. So if it's given at 2, how long could it take for you for the onset to happen, and when can the insulin peak? All right. Is it an onset at 2, peak at 3, onset at 2:15, peak at 3, onset at 2:30, peak at 4, or onset at 4, peak at 6? All right, what are we thinking? Shout out to everybody who is just now joining. We're doing NCLEX questions. Hopefully everybody had a good weekend. Graduation in full effect, full swing. Congratulations to everybody that's graduating. Or graduated, I should say. We're on the road to 20,000 likes. If I don't have 20,000 likes by the time I get to question 20, then hey, I guess we're stopping at 20. Regular insulin is 30 minutes with an hour onset, I believe. Okay. B? I'll go with B. All right, well, let's see. Let us see what the answer is. And the answer is C, the onset to be 2:30 and the peak to be at 4. Regular insulin, which is a short-acting insulin, has an onset of 15 to 30 minutes and peaks 2 to 4 hours. Because the nurse gave the insulin at 2, the expected onset would be between 2:15 and 2:30, or 2:15 to 2:30, and the peak from 4 to 6 p.m. All right, so shout out to y'all. Shout out to y'all for getting that answer right. This is part of pharmacological and parenteral therapies. Listen, there's going to be some type of endocrinology, anything involving diabetes, I guarantee you is going to be on your test in some way, shape, or form. They test diabetes like it's going out of style. It's not ever, but y'all get what I'm saying, right? So you have to understand all aspects of diabetes. All right, DKA, HHNS, the peaks, onset, durations of all the insulins, hypo and hyperthyroidism, right? Hyperglycemia. You got to know it all. You got to know everything about it. All right. So shout out to y'all for getting it right. If you get it wrong, circle back. All right. So y'all can get that. All right, y'all. Here we go. Question number 19. The physician orders laboratory test to confirm hyperthyroidism in a female client with classic signs and symptoms of this disorder. Which test result would confirm the diagnosis? All right. Is it a no increase in the TSH levels after 30 minutes during the TSH stimulation test? A decreased TSH level, an increase in the TSH level after 30 minutes during the TSH stimulation test, or below normal levels of T3 and T4 as detected by radio immunoassay. What's up, Naz? Hey, y'all, Naz is in the building. Naz is one of my mods. She never shows up on time. So shout out to you, Naz, for finally getting here. We started like 4 hours ago. No, I'm just kidding. Hey, if you guys are just now joining, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself, both for RNs and LPNs. RNs and LPNs, even if you live in Canada. Even if you live in Canada and you own a poodle. Oh my God. So what do we think? Everybody's telling me some C's. We got a D over here. All right, City Girl. I see you with the likes. All right, here we go. Here we go, y'all. Let's see what the answer is. Let us see what the answer is. In 3, 2, and the answer is A. No increase in the thyroid stimulating hormone after 30 minutes during the TSH simulation test. All right, so failure to rise after 30 minutes confirms hyperthyroidism. All right, simple as that. Remember, on nurseslabs.com, even though they're free sets of questions, they're not always the most reliable. I'll be completely honest with you. We go through this so you guys can get into a routine of studying. If anybody ever asks for a recommendation where to get their questions from, either UWorld or Archer, Kaplan has good questions as well. So, when it comes to doing their questions, those are the ones that I recommend. Reduction of risk potential, 9 to 15% on the NCLEX exam, making it the 4th largest section on the NCLEX exam. All right. Hey, but Nurses Labs will get you started. Nurses Labs will get you started. Some people just only use Nursing Labs and they pass, but hey, that may not be you. That may not be for you. All right. Here we go. Question 20. Question 20. Rico with diabetes mellitus must learn how to self-administer insulin. The physician has prescribed 10 units of U100 regular insulin and 35 units of U100 isophane insulin suppression, or NPH, all right, to be taken after breakfast. All right. When teaching the client how to select and rotate insulin injection sites, the nurse should provide which instruction? I took my NCLEX today, shut off at 96. I feel horrible. Hey, I would rather you feel horrible now than you feel horrible while you were taking your exam. All right. Remember, the biggest thing that we control our anxiety, and we can control our nervousness. All right. So is it A? Oh, and I know that you did great. I know that you did great. Who said your mom? Well, your mom did great. I know it. All right. Is it inject insulin into healthy tissue with large blood vessels and nerves, rotate injection sites within the same anatomical region, not among different regions, administer insulin in areas of scar tissue or hypertrophy wherever possible, or administer insulin into sites above muscles that you plan to exercise heavily after that day? What are we thinking? All right, got D, we got A. I'm telling you, endocrinology that's a big one. That's a big section. That's a big section that you need to know. Pharmacology, you need to know it. You need to know your pharmacology, all right? The pharmacology is never, ever, 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 ever going to go away. Ever, ever. So you guys have to know it, all right? Now think about this, all right? This is talking about specifically medical administration. So we know we're giving insulin, right? We have to understand how we give insulin and where we give insulin and why we do this in that specific way. All right. And why we do this in a specific way. Naz, you're probably wrong. Everyone else says B, but Naz says B. So I'm just going to say that Naz is wrong. But the answer indeed is B. All right. It is B. Rotate injection sites within the same anatomical region, not among different regions. Okay. The nurse should instruct the client to rotate injection sites within the same anatomical region. Rotating sites among different regions may cause excessive day-to-day variations of the blood glucose levels. Also, insulin absorption differs from one region to the next. All right. Health promotions and maintenance, which is 6 to 12% on the NCLEX exam. All right. So you want to keep with the same area that you're going to be given insulin all the time. So if it's given via the abdomen, you switch to different regions. If you're going to be giving it in the arm, then you keep it in the same region of the arm, or you can even switch arms. All right. But it's still same anatomically. It's just on the other side. All right. So think about that when you guys are getting prepared to do medical administration as well as diabetes. This is another diabetes question. All right. Another one for endocrinology. Once again, ladies and gentlemen, hey, go over there and get you guys some test taking tips. All right. Test taking tips to help conquer the NCLEX, 42 pages. It's free. It's free download. Hey, once you do it, I email it to you. And then, hey, it's yours. Hey, it is yours. Hi, Mr. Kevin. I passed my exit exam. That's what I'm talking about. Is it Darley? Miss Love Darley? Shout out to you for rocking that thing. I had no doubt that you were going to do your thing. All right. So, hey, make sure you guys go over there and get that. All right. Hey, I got a book coming out, y'all. It's actually a published book. Like I'm about to be a published author. All right. And a published award-winning author. All right. Talking about my journey to passing the NCLEX, because everything that y'all are going through, I have been through, even if it's your first time or if it's multiple time. All right. Remember, I took my NCLEX 3 times and I passed on the 4th. There's a lot of nuances that are in between there that people don't see, especially if you're preparing to take this exam. But go over there, check it out. If I've helped you in any way, go over there and support that. All right. You can go over there to bootnurse.com/books. You can get it off Amazon. Hey, once it's available, it'll be available, and we're launching on June 5th, which is my 4-year anniversary. It'll get shipped straight to you. So make sure you guys go over there and check that out. All right. Hey, lastly, I was on a podcast. Talking about my experience in critical care, talking about NCLEX prep, which is what I do for y'all, as well as building a community online, which is what I do for and with y'all. All right, you guys go check it out. It's Nursing Uncensored. Nursing Uncensored. Make sure you guys go and check that out. All right, make sure you guys go and check that out. All right, how tall are you, Kevin? I am 6'1" on a good day. Today, I don't feel 6'1". I feel probably about 5'1", because I'm tired. I'm sleepy. All right. Oh, y'all got me to 20,000 likes? Stop. I guess y'all want more than 20 questions. Okay, here we go. That's my son's Earth Day. Shout out to your son's Earth Day. Not on a good day. Listen, stop playing with me. All right. I'm tall. No, I'm not. I'm 5'7". I'm a short king. Short kings out here. We rule the world. All right, here we go. Question 21. Nurse Sarah expects to note an elevated serum glucose level in a client with HHNS. Which other laboratory findings should the nurse anticipate? All right, should it be elevated serum acetone levels, serum ketone bodies, serum alkalosis, or below normal serum potassium levels? What do we think it is? What do we think it is? What do we think it is? Same archery? What are we talking about? Hey, shout out to everybody that's just now joining. We're doing NCLEX questions. Got them off of nurseslabs.com. Nurseslabs.com. It says the rest of them are DKA. Okay. Asian think dehydration. Melina, did you just get in here? You must have just got in here. But let's see. Let us see what the answer is. Yeah. Okay. I figured. All right. Here we go. And here's our answer. The answer indeed is D. All right. So below normal serum potassium levels. A client with HHNS has an overall body deficit of potassium resulting from diuresis, which occurs secondary to hyperosmolar hyperglycemic state caused by the relative insulin deficiency. That's part of reduction of risk potential. Reduction of risk potential, which is 9 to 15% on the NCLEX, making it the 4th largest section on the NCLEX exam. All right. Understand. Hey, once again, we're talking. This is endocrinology, right? Thank you for this. I test on Tuesday. Melina, you're gonna be all right. You're gonna be all right. Hey, so Melina, tomorrow you don't need to be on nobody's TikTok. You don't need to be on nobody's nothing. You need to be relaxing as much as possible. And then on Wednesday, you go in and you do your thing. You go in and you do your thing. That's right. Salute. Right. All right, here we go. Question number 22. For a client with Graves' disease, which nursing intervention promotes comfort, restricting intake of oral fluid, placing extra blankets on a client's bed, limiting intake of high carbohydrate foods, or maintaining room temperature in the low normal range. What are we thinking? Thinking C. Now think about this. What is the name for Graves' disease? What is Graves' disease? All right, we got some people saying D. Somebody told me who said it was definitely C. All right, so hyperthyroidism. Now, somebody who has hyperthyroidism or has hyperthyroidism, everything is what? Is it up or is it down? Hot, 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 hot. Right? So if everything is high, think about that. If everything is high, right? And if they're hot and if they have a high metabolism, right? Why would I want to limit them from carbs? Because if they have a high metabolism, they're going to burn those carbs off. I wouldn't want to limit them. I want them to have those carbs, right? However, if they're hot, I definitely do want to make sure to maintain the room at a low temperature, right? Because Graves' disease causes signs and symptoms of hypermetabolism, such as heat intolerance, diaphoresis, right? Diaphoresis, excessive thirst and appetite, and weight loss. To reduce heat intolerance and diaphoresis, the nurse should keep the room temperature in the low normal range, all right? Because they are hot. I'll never forget that now. Well, Naz, you're welcome. You're welcome. Basic care and comfort. All right, basic care and comfort, which is 6 to 12% on the NCLEX, y'all. 6 to 12% on the NCLEX exam. Smaller section, but still very much important. Yes, because everything is high. So hey, if I have Graves' disease, I'm going to feel hot. Internally, I am going to feel hot. So what's the best way for me to not feel hot? Turn the AC down. That's right. If you live in Texas or Arizona, y'all are going to know exactly what that feels like here now. Now till October, it's going to be hell on earth. Best believe that. All right. So basic care and comfort, 6 to 12% on the NCLEX. All right. I love the endocrine system. I'm telling you, endocrine is huge. You can't relate. Yeah, that's because you live like in space somewhere where it's like negative 200 degrees. All right, here we go. Question 23. Patrick is treated in the emergency department for a Colles fracture sustained during a fall. What is a Colles fracture? You're not wrong. I know it. Y'all got penguins up there? I didn't know y'all had penguins in Canada. Oh, that's crazy. Is it a fracture of the distal radius, a fracture of the olecranon, a fracture of the humerus, or a fracture of the carpal scaphoid? What do we think it is, y'all? Shout out to all 75 of y'all out here rocking. If you guys are just now joining, we're doing NCLEX questions. NCLEX questions. I don't know, but I'm going to guess B. Okay. I would rather you guess. Because sometimes you don't know. All right? Because think about it. If you don't even know what this is, I'm like, all right, cool, fracture. That's telling me it has something to do with the bones. All right? Humerus is a bone. Olecranon, bone. The radius, a bone. Scaphoid, bone. Now you're just like, well, hell, which bone are we talking? All right. And if you don't know, that's okay. That's just like Legionnaire's disease. I had no idea what it was when I was studying. Looked at it and I was just like, well, ain't that something? All right. When in doubt, guess B. Sure, Katie, whatever you want. All right. But the answer is A. The answer is A. All right. So is a Colles fracture is a fracture fracture of the distal radius, such as from a fall on a outstretched hand, and it is most common in women. All right, physiological adaptation. Physiological adaptation, y'all, all right, which is 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam. All right, the third largest. Is that an otter? Is that an otter? You know what, whatever. But hey, so make sure if you don't understand this, hey, circle back and just learn what some of those fractures are. All right. Like I said, some of y'all will probably never see these fractures again. You'll probably never even see that as a nurse ever again. But it's okay if we brush up on it a little bit, right? It's okay if we brush up on it a little bit. Here we go. Question 24. Cleo is diagnosed with osteoporosis. Which electrolytes are involved in the development of this disorder? My new favorite emoji these days. Don't mind me. Fair. Is it calcium and sodium, calcium and phosphorus and potassium, or potassium and sodium? All right. What are we thinking? Hey, if you guys are just now joining, hey, by the way, anybody, y'all can go to nurseslabs.com to get these. Lovely Darley is saying definitely B. Okay. All right. Naz is telling me B or C. Now, if this had anything to do with microbiology, no, let me stop. But like I said, make sure you guys go over there and you guys check it out. Shelby is definitely saying B. Okay. Geraldine is also telling me B. Cool. Well, let's see. Let us see what the answer is. When high calcium is high, phosphorus is low. Okay. All right. Well, let's see. And the answer indeed is B. It is calcium and phosphorus in osteoporosis. Bones lose calcium and phosphate salt, becoming porous, brittle, and abnormally vulnerable to fractures, right? So very much correct. Physiological adaptation, 11 to 17% on the NCLEX exam, making it the third largest section. All right, the third largest section on the NCLEX exam. Okay, so shout out to all 76 of y'all. Hey, if you got it wrong, circle back. Understand what the disease process of osteoporosis is, not cordyceps. Okay, I'm sorry. Here we go. Question number 25. Johnny, a firefighter, was involved in extinguishing a house fire and is being treated for smoke inhalation. He developed severe hypoxia 48 hours after the incident, requiring intubation and mechanical ventilation. He most likely has developed which of the following conditions? Is it ARDS, or acute respiratory distress syndrome, atelectasis, or atelectasis, there it is, bronchitis, or pneumonia? What do we think it is? Everybody's telling me A. Jillian's telling me B. Okay. All right. Got a bunch of people. Oh, got Faye is telling me B. Okay. What else do we think? Best guess, A. Okay. What would be the dead? Now let's read this question. Let's think about this. We have a person who was involved with a house fire and he has smoke inhalation. So now we're talking about an airway breathing issue, right? We're talking about an airway breathing issue, right? Now he develops, keyword, severe hypoxia. All right. Severe hypoxia, meaning severe low oxygen, right? 48 hours into the incident, which requires him to be intubated, right? So he's mostly developing what? Think about it. He's mostly developing what? Look at our answers. We're talking about respiratory distress syndrome. All right, now let's see. Most definitely thought it was D at one point, but it indeed is A. It is ARDS. It is adult respiratory distress syndrome, right? So severe hypoxia after smoke inhalation is typical, usually for people that go and do anything that has a smoke inhalation. If it's a firefighter or if it's a patient or anything and they have smoke inhalation, remember there's an issue with the carbon dioxide and the oxygen exchange because of carbon monoxide, right? Just took my NCLEX on Saturday and passed. Mel, ooh, I didn't trick you. I just asked. I just asked a question. I didn't say, lovely darling, look, this is the answer. I didn't trick you. Madam. All right. So, but think about this. All right. We have a respiratory syndrome, right? Acute or adult respiratory syndrome. All right. Think about that. And atelectasis has nothing to do with smoke inhalation, right? Bronchitis does not develop due to smoke inhalation, right? And pneumonia doesn't have anything to do with smoke inhalation, right? Pneumonia is a bacteria, right? Think about that. You did? No, ma'am, madam, I did not. I just said, let's read the question. That's all I said. Remember, and when you read the question, that's what I want for you guys. I want you guys to do the same thing. All right. Hey, but that's Melly. Melly, congratulations. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give, what would it be? What advice would you give to everybody out here? And once again, congratulations to you. All right, ladies and gentlemen, that is it for the questions today. That is it for the questions. I appreciate everybody hanging out and participating. I know we started off a little rough, right? Somebody came in here and they were just like, hurry up. You already know how I feel about that. Don't come in here and tell me to hurry up. All right. I'm trying to make sure that I meet everybody where they are. And some people it's hard to determine what people are talking about. So, or how they're even conveying a message over Messenger, right? So just want to make sure that, we're all on the same team. I want y'all to do great. That's all I ever want. When will you do this again? I'll do it. Maybe I'll do it on Wednesday, but I'll definitely do it on Friday for sure. Yes, Samantha, I just finished. Literally, I just finished. I appreciate all the love and likes. Although the gifts are not mandatory. They are 100% welcomed. I didn't ban anybody today. I'm a little sad about that. I planned on banning somebody, but I didn't. So, oh well. Nurseslabs.com is where I got these questions from. You guys can go over there and check them out for yourself. Make sure you guys go check out Nursing Uncensored podcast. Also, hey, if you're in the market and you need an NCLEX course, I have an NCLEX course that you could have. It's $97 and you have it for a lifetime. I have 2 NCLEX reviews in there. It works both for RNs and LPNs. And I have 2 reviews in there plus an additional 80 videos of content. 80 with more going in here within the next month or so. All right. So if that's something that you want, go over there and check it out. Also, if you need a book, an ebook that you can check out for you for NCLEX as well. You can check that out. Or if you're a person who's taken the exam multiple times, you can check that out as well. All right. You can check that out as well. Naz, what are you talking about? What are we talking about? It says my thumb hurts for liking. That's okay. I need that thumb to hurt all the time. All right. What's up, y'all? How y'all doing? You're welcome. We just always go at a good pace, in my opinion. We do go at a good pace. We really do. There's some people that come in here. I heard somebody tell me they were just like, bro, you're doing too much yapping. And I'm just like, that's kind of crazy how you're over here getting this knowledge from somebody and you're telling me that I'm yapping, but whatever, you know what I'm saying? But what's up, y'all? How y'all doing? Hey, if you guys are just now joining, we just finished doing NCLEX questions. I'm going to do an Ask Me Anything real quick. Hang out for, I don't know, for however long you guys ask me questions. So what questions do you guys have? What questions do you guys have? See, Naz, 6'1", right here. Oh, man. Everybody left. Oh, no. That's all good. Hopefully everybody had a really good weekend. Are you actually that? No, I'm not 6'1". I'm 5'7". 5'7" tall. Short kings unite. Straight up. Straight up. So now I don't believe you. We'll leave that up for interpretation. Faye, you are very welcome. Shout out to all 48 of y'all. Hey, like I said, if you guys are new here, just know like I've been through the same journey. I've been through the same journey as y'all. I've been through nursing school. You know, nursing schools are all relatively the same. They all suck. Every single one of them. ATI, HESI, Kaplan in school, they all suck. I know it. The entrance exams, they all suck. I've been through it. HESI or NCLEX, been through it 4 times. It sucks, period. I know how you feel. So when I tell you that I understand, I understand. What are we thinking? It says, don't study the day before the NCLEX. Melina, I don't know if Melina's still in here, but Melina, that's a good one. I just told her that. The only thing I watched the day was your video on your page. Which video? Which video? Oh, videos on my page. You're talking about on my TikTok page. Okay, cool. I'm low-key going through it these days. I can't wait to get all over it. It is depressing. Nursing school is very much depressing. But in the end, how bad do you want it? In the end, how bad do you want it? I'm guilty of studying the day before and the morning of. See? But all that does is just increase your anxiety. Like, you know, so I tried to find ways to reduce that, right? And I even did it. I practiced what I preach. I did the same thing. I was studying in the bathroom before I had to check in. Okay, that's bad. I would not recommend that. Oh, I want it bad. Okay. Well, if you want it bad, then you know what you got to do. And you know what you got to keep doing. Putting in that work. Hey, Nurse Kev. Hey, Black is Beautiful. What's up? How are you? We'll see what else y'all are asking. But yeah. So yeah, like I said, I failed the NCLEX 3 times, Joe. I failed it 3 times. And it took my 4th time for me to realize that I needed to get out of my own way. And I ended up getting a mentor. I talk about this in my book. I talk about this all over the place. All right. I believe that everybody should have a mentor in some way, shape, or form. That's another reason why I did TikTok is like, you know, I can reach a bunch of people. And if you guys ask me questions, cool. And if you guys want, you know, one-on-ones with me, you can reach me that way. I mean, you know, the skies are the limit. But my recommendation is to find somebody who has been in that position that you are currently in to get you over there, to get you over that hump, to get you that license. All right. The question of the day on your TikTok page was the only videos I watched the day before. Oh, okay. I got you. And you like those. I'm guessing you like those. She's just like, yes, keep doing them. That's going to be on my motivation board now. How bad do you want it? Yep. And I'll ask you that too. How many questions do I study a day? In my opinion, and it has worked very much for me and it has worked very much for all of my coaching students that I've coached in the past, is you need to be doing a minimum of 85. Why do you think? Why do you think I would tell you to do a minimum of 85 questions a day and a maximum of 150 questions a day? So at the bare minimum, you need to be doing this, or whatever in between. Why? Because that's the minimum. 85 questions is the minimum on the exam. So why would you not train to that? Why would you not train to that? 150 questions is the max. So why would you not train for that? I would never tell you to sit here. Yeah, do 20 questions and then, go take an hour break. I would never tell you to do that. That's like me telling you to do 20 questions on the exam and then go take an hour break when you're on a running clock and it never stops. The only time the clock stops is when you run out of time or when the test determines that you have passed or failed. That's it. That's the only time that it stops. So there you go. That answers your question. And you're probably going to ask me how many hours a day you should study. On average, if you want me to just give you a blanket number, I say 4 to 6 hours. However, there are a lot more nuances that are in between there. All right. Anxiety provoking. Who's anxiety provoking? I'm not. I'm trying to help you ease that anxiety by giving you, steps and processes so you don't have that. Not you. The NCLEX. When I took it the first 3 times, so the first 2 times, it was definitely that. Like the second time I took it, I'm pretty sure I had a panic attack. Like it was pretty bad. Third time I took it, I was a lot more confident than I was in the second time. But the last time I took it, I didn't have any issues. Like I walked in there and I was just like, oh no, I'm gonna rock that. We're gonna make that happen. Most definitely. And I went in there. And it was right when COVID had broke out because COVID had, did its thing in like March. I was supposed to take my NCLEX at the beginning of May. And then in April, they shut down all the testing centers. And then a week later, we got emails saying that, hey, here are the restrictions, get in where you fit in. And I took it so I was actually given an additional month, for me to study for NCLEX, which was great. And I was just like, cool. I don't gotta go to work. I don't gotta do nothing. I can sit here, bro. I'm about to take full advantage. And I took full advantage of it. While everything was happening out here, which was terrible, in my little world, I was able to take advantage of that. And so, some of these things are a blessing in disguise for sure. It says, would you say NCLEX was more difficult than the exit exam? No. The NCLEX, in hindsight, the NCLEX was easier than the exit exams. To me, the thing that really upsets me about the exit exams is that when I asked, at least when I was in nursing school, when I asked about the exit exams, wow, I can't talk, but when I asked about them, no teacher could help you. No teacher would help you, and they couldn't help you because they were like, oh, we don't know what they're going to test. We don't get access to it. And I was just like what? And I'm a teacher. So when I see that, I'm just like, how in the world, I'm not trying to fish answers from you, but I'm just like, how do you not know what is on this test? You know what I mean? So I don't know. I just didn't like it. Do you know how scores on the NCLEX? Do you know what scores on the NCLEX predictor are good? If you're talking about ATI, I know nothing about ATI. Kevin, not sure if you remember me a few weeks ago being scared. Found out I passed Thursday before graduation. Dawn, you found out what? I need for you to specifically tell me you did what? Oh, you're doing Kaplan? I don't know. Well, when I use Kaplan, so I don't know. I think Kaplan uses a different system when you're in school. When I purchased Kaplan, it was, through their NCLEX other review. Oh, Dawn, you passed NCLEX? Yes, Lord. That's what I like to see. That's what I like to see, ma'am. And yes, I do remember you when you told me that you were scared. Did I tell you to go to church? I'm pretty sure I did, right? But hey, ladies and gentlemen, Dawn, Pastor NCLEX. Congratulations, Dawn. Welcome to the greatest shit show on earth, known as being a nurse. Congratulations to you. If there's a piece of advice that you could give all 34 people out here, ma'am, what would it be? And once again, congratulations to you. Congratulations to you. Crystal RN. Yes, sir. That's what I'm talking about. And every single one of y'all that are in here, y'all are going to be nurses. All right. I'm speaking that into existence. All right. Putting that into the universe, and the universe is going to give it back to me, and I'm going to hold it hostage. And then I'll eventually I'll pass them out to y'all. You know what I'm saying? But no, y'all are going to be good. Y'all going to be good. That's what I'm talking about. That's what I'm saying. Like, come here and tell me what y'all got going on. Right. Because we want to celebrate y'all. You know what I'm saying? Don't be scared. You know it. If you aren't 100% on select out of if you don't know, don't pick it. All right. Remember, select all that apply now is partial credit, right? It is now partial credit. All right. So if you don't know, remember, think of select all that apply as true and false, right? There is no, oh, well, it can be. If you start sitting there while you're answering that question, you're like, well, it could be this, you better not pick it. Even if the answer is correct, you better not pick it, because that's how you're training yourself. That's how you're training yourself. All right. Shout out to all 30 of y'all out here rocking. Hey, we just got finished doing NCLEX questions. Now we're doing an Ask Me Anything. Anastasia, first of all, why are you screaming at me like that? Where have you been? Where have you been? You missed it. We're done. We're not doing no questions. I did them already. What are we thinking? What are we doing? Hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. My name's Kevin. Been a registered nurse almost 4 years. All right. Registered nurse almost 4 years. Worked ICU, OR, and PACU, as well as I was in the Navy for 16 years. All right. And failed my NCLEX 3 times. And so what better way for me to give back to my people, my community of folks, than nurses and nursing students? So here we are. Took my T's and I got an 82.7 and submitted my application for nursing school. Shout out to you, Miss Lady. Yes, I love to see it. I love to see it. It says I got to hop back on my Kaplan prep. Thank you, Kevin. You're welcome, Katie. Go do your thing. Go do your thing. Oh, good heart. Naz, are you talking about me? Naz, I don't know if you know, I'm a terrible person. No, I'm just playing. No, this is why I do it. Like, it's more of a, this isn't like a passion. It's an obsession. Like, all I do all day, every day is talk about NCLEX. Sir, why you ignore my question? Ma'am, what did you say? September Stone. First of all, you know I don't ignore your questions. All right. If your question came across, I would answer it. I did not see said question, madam. I did not see said question. All right. But what else? What else y'all want to talk about? I'm gonna hang out for a little bit. Is it Jasmine or Jasma? Jasmine. I'm from Georgia. Just applied for my RN program. Shout out to you, Miss Jazzy Jazz. All right. You just applied for your RN program. Okay. I don't know exactly what RN program that you applied for. One thing I can say that can really, really help you is volunteer hours. This is for everybody that's not in nursing school right now. Anastasia, I think this is for you as well. Jazzy, the second way you said it. Oh, okay. Got you. So volunteer hours, right? Volunteer at the Red Cross doing something, right? Volunteer at the Red Cross at the hospital. They'll give you a letter of recommendation. You put that with your application. It makes you look good because it's showing that you're taking your personal time and dedicating it to a profession that wants you to be able to take care of other people, when in need, right? What's a good first job? I hear post-acute is overwhelming and home health is risky. So here's my question to you. What do you want to do? That's just like me asking you, why do you want to be a nurse? It can't be why I want you to be a nurse. It has to be why you want to be a nurse. So it's the same thing when it comes to your job. Like, what do you want to do? Do you want to do peds? Do you want to do acute care? Do you want to do trauma like in the ER? Do you want to do med surg, labor and delivery, NICU, PICU? Like, what do you want to do? Absolutely not. What are we talking about? What do you mean absolutely not? Man, we're not having a conversation on the phone. I don't hear what you're saying, Naz. My goodness. But what I will say to you, Stone, is peds. I cannot do peds. Same. I can't do little kids. It all just depends on where you want to go. Now, a lot of people will try to shit on med-surg. I don't shit on med-surg, right? Because med-surg is a specialty. It is a specialty, right? And med-surg is a great place for you to learn your time management skills. All right. Learn your time management skills, right? And I started off in critical care. I went straight to the ICU, right? And ICU is it can be very fast paced, right? Because you're getting, it's like, what is it? Baptized by fire, right? You're just getting all this information thrown at you at once, and you have to learn it very, very quickly. Versus how in med-surg, it's a little bit slower. And I say it's a little bit slower because I've been floated down there to med-surg before, and I'm just like, oh, well, this isn't so bad. But that's just because I was so used to being fast paced. So like I said, it all depends on you. Acute stuff can be overwhelming. Home health can be very risky because you're going into somebody else's home, right? And you have no idea who these patients are, what they're capable of, or who they invite into their house or what they have in their house. You always have to be you have to be on guard when you do those things. But there are people that need it. It is a very well needed portion of nursing. All right. Labor and delivery for you, Jazz. Okay. So here's what I'll tell you, Jazz, is that a lot. All right. So while you're in nursing school, or if you're not in nursing school right now, I would recommend, if you're not a tech or anything like that, like really building a relationship with your local labor and delivery unit, like wherever they are. And the reason being is like when you start to build that rapport with them and you graduate, whoever the directors are or the managers are or anything like that, they're going to be like, hey, Jazz, whenever you're ready to apply, let me know and I'll pull your application. So, you heard the term, it's not about what you know, it's who you know. It's just like that. Hey, Nurse Amber's in the building. Nurse Amber, a.k.a. Nurse Glamber, a.k.a. she is the NCLEX strategist, my A1 since day one. She is the homie. Make sure you guys go over there and you guys follow her over at Enhanced Nursing. All right. She is the yin to my yang, the light to my darkness. She is light skinned, so I guess that kind of makes sense. And the good cop to the bad cop, I guess, right? So we got some great stuff coming for y'all. All right. We got some great stuff coming for y'all. So if y'all don't follow Nurse Amber, what are y'all doing? Go do that. Go do the damn thing. All right. But Jazz, that's what I would recommend for you. And I would actually recommend that for anybody. So, yeah, I would definitely do that. Naz, I would say the same thing for you. If you know people that are infectious control, especially that work in the hospitals that are near, I would do that same thing. Be like, hey, I'm already, PhD'd in microbiology, but I'm trying to be a nurse because of reasons. But, that's how you can get into those places, is by building those rapports with people. All right. But then for you, Naz, when we talk about microbiology, it's not hard for you to go to a med-surg unit, work there for a year or two, find an opening in infection control or quality control or wherever in a hospital, and then jump right into it. What was the hardest class for you during your journey? I think the hardest class for me, at first it was fundamentals. Mostly it's because I had like all these years of medical experience as like an LPN. And so I had a hard time turning off LPN, hospital corpsman. I had a hard time turning that off to become an RN. So I almost actually failed fundamentals. I got a 78 and you needed a 75 to pass, and I almost failed it. And it was my own fault. But then after that, I want to say probably my hardest class was pharmacology. Pharmacology is a monster. And that was a prereq. Like we had to do that before we started nursing school. So that was a prereq. Yeah, it was a prerequisite. So not so bad though. Not so bad, but it was definitely fundamentals because I couldn't get out of my own way. Once I got out of my own way, it was kind of med-surg. Oh, let me tell you something about med-surg. I failed my first med-surg exam, I think, with like a 68, and you needed a 70 or a 75 in order to pass. Ooh, boy, that was a monster. Med-surg will be that one that will, that's like the nurse killer in school. The student killer is like med-surg. Fundamentals fundamentals will show who can hack it, but med-surg will be that one to be like, hey, you thought you could hack it, now we're going to see what you're really about. If you can get past med-surg, you'll be fine. If you can get past med-surg, it'll be fine. I kind of like it was a prereq, less pressure. Yeah, for sure, it most definitely was. I graduated my LPN in July, then bridged to my RN. Shout out to you. Shout out to you, Crystal. Shout out to you. But yeah, what other questions do you guys have? Let me see what's going on. Let's see. Like I said, if you guys are not following Nurse Amber, like I said, her and I got some stuff planned for y'all. We're collabing on a bunch of stuff. So we got some stuff coming up for y'all. So make sure you guys stay tuned during the summertime. Summertime. Make sure you guys are up to date on that, all right? What other questions do you guys have? Hey, it's 7 o'clock, y'all. 7 o'clock. It says, I've heard stories about pharmacology and med-surg. Look, the stories are true, ma'am. The stories are true about med-surg and pharmacology. They're indeed true. Pharmacology, when you're taking that class by itself, it is a lot of memorization. When you're in nursing school, it's about applying those meds to their specific families and to the specific body systems, right? Advanced med-surg almost killed me first. My professor, it was his first time teaching the lecture. So, hey, it be like that. Unfortunately, Noemi, it really do be like that. It's just like, hey, we're all in this together. All right. I just want to let y'all know I don't know what I'm doing, but we're going to figure it out. Right. It'd be like that. It'd be like that. But hey, if you guys are just now joining, I did NCLEX questions. If you don't know what NCLEX questions are, those are the questions for registered nurses and licensed practical nurses or vocational nurses, because those two are both the same thing. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. All right. And make sure you guys go over there and check those out. All right. Make sure if you guys aren't following me, you guys follow me, because I do these lives every Monday, Wednesday, Friday at 5:30 Central Standard Time. All right. Central Standard Time. All right. And also, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what are you doing here rocking? My goodness. Oh, all right, cool. And don't nobody got no questions for me? Cool. You guys don't got no questions. All right, here we go. Well, I appreciate everybody rocking with me today. Like I said, I hope everybody had a really good, safe weekend. I want everybody to have a good, safe rest of the week. Do you recommend a new grad doing hospice or home health? You can, for sure. You can start. I mean, most people that do go to hospice, they'll end up having some experience. So it all just depends. I mean, hospice, you're doing a lot of death and dying, right? You're doing a lot of death and dying. Home health is it's not necessarily the death and dying. It's just like you're very independent on your home health, especially when it comes to like doing wound care and charting. Now, as a new nurse, do I recommend you do it? No. I recommend you at least go to the hospital and get at least 6 months to a year of experience before you decide to do home health, because like you're independent when you do that. You're independent when you do that. How hard was the NCLEX for you? I failed it 3 times and I passed on the 4th, Jazz. So if that answers your question, it was difficult for me. There was a multitude of things that were difficult for me due to like a bad relationship that I had, to my military service, to my lack of content, my own accountability, just a lot of things. I heard home health is it is a lot of documentation, a lot, right? And with ATI, oh my God, they switched the exam when he knew what was on it, and most of it he didn't know. Yeah. And they don't let you know, like most of the time, they don't let the instructors know like what's on the exam, which I thought was absolutely terrible. But, a lot of people say don't teach the exam. I've literally done a review for some students that I've had when I was a surg tech instructor. I went through the review. I went through the actual tests, and I mixed in a whole bunch of like 100 of questions. And I still had 6 people fail. Even though I went through all the questions that were on the test, I still had people fail. So I just thought that was probably the most hilarious thing anyway. But so yeah. So make sure you guys check out everything I got going on. All right. Make sure you guys check me out on Instagram, on YouTube, because we don't know what's going to be happening with TikTok. All right. If you need an NCLEX review, check it out. I got one, $97. You pay it once. You don't ever have to pay it again. You get all the updates. You get all the updates to this course. All right. And yeah. That's pretty much all I got for y'all. I appreciate everybody coming and rocking with me today and doing these questions. If you guys have any questions, comments, or concerns, you guys can drop me an email, or you guys can DM me. I'm very active on those things. And if you need one-on-one coaching for NCLEX, such as you failed, you don't know where to start, you have bad time management, you need help with a review, or you need help with not a review, but you need help with like a schedule, all that stuff, one-on-ones for breaking down NCLEX questions, understanding content, I got you. I do that as well. That link is also in my link tree on my main page. You'll see it. It'll say coaching and mentoring. All right. But you guys are awesome. I love y'all. I appreciate y'all. I know that y'all are going to do great things when you guys get out here and start doing your nursing thing. But hey, first things first is that we got to get through what we are currently in. So if you're getting into school, if you're getting through your semester, if you graduate, you got to take those steps. All right. But I know y'all are get there. Take care of yourself mentally, because if you can't take care of you, then you are no good to nobody. All right. But I appreciate y'all, and I'll see y'all on Wednesday.